Welcome RHD to the COVID Town Hall. Thank you for joining us today. We have a full agenda, so I'm going to
Okay,
hand
I
it
have
off.
sent it out. Yeah.
Oh, thank you. If we can, I'll go ahead and hand it off to Sandy to open us up with some opening remarks. Let's see, is she on the call? Maybe not yet. So why don't we start with the housekeeping? Sherry, would you want to pull up the agenda? All right, well, thank you so much. So once again, good morning and good afternoon, RHD. So welcome to this COVID Town Hall. Just as a general update, we wanted to make sure you were all aware that we are not having a town hall next Monday due to Indigenous Peoples Day. So there will not be a COVID town hall next Monday on October 11th. As always, we encourage you to submit your questions. So you can always submit your questions anonymously using your voice, and we'll make sure that we are able to ask those. You can submit your questions using the COVID-19 inbox. You can submit your questions through the Zoom chat, and we'll make sure that we're categorizing and keeping an eye on all the questions that come in there. Or you can submit your questions by raising your hand. So as always, lots of different ways to make sure that your questions get answered. Our meeting agenda for today. So I'm going through the housekeeping now, and I'm going to hand it over to Brian to give an update on COVID numbers and to talk about COVID Corner. Then we're going to have an update from Alicia on vaccine reporting updates. We're going to show a video from FPCN and spend lots of time with questions and answers. And then we will go ahead and conclude with Deanna for some closing remarks. Okay. So let's go ahead. Let's see if Sandy is on for some opening remarks. Sandy on.
Danny, I just spoke with Sandy.
Oh, go ahead, Vern.
She's having some technical difficulties. She should be hopefully on in the next minute or two. It's, technology is a beautiful thing when it works.
Yes, it is. All right. Thanks for that update, Bernie.
I don't know if Brian wants to take us through the numbers and do the COVID corner. We go a little bit out of order today.
I was going to suggest that, Sherry, just because we'll do a little padding so that she has time to join us. So maybe we can put her in between the numbers and COVID corner. So I apologize for keeping my camera off at this point. I know everybody enjoys seeing my face every other week, but right now I'm going to keep the camera off. So currently we have received 3,068 reports since March of 2020. Of those reports, we have received 855 confirmed reports, 1,541 negative reports, 84 suspected, and 571 possible exposures. So at this point, I am going to share my graph like I typically do with everybody, just so everyone can look at the same thing that I am. And can everybody see my screen? Okay, very good. I see some thumbs up. So what you can see here is that we had a pretty active week, the week ending September 18th, and we did make mention of that the last time that we were here together in Town Hall. But what you can see what's happened since then is that the numbers have really come down again. So it looks more typically like we saw in July and August. So the number of reports have come down, which is good. So and that's kind of in line with what we're seeing nationally too, because I usually do a national perspective as well. And nationally, the reports have also been falling as well too. Some of the southern states that really saw some high infection rates over the summer have really started to level out. So that's always good. And as with what I said the last time we were here in Town Hall, is that we still need to be concerned about the upcoming fall and winter season. We're really kind of sitting here on the cusp. The days are getting shorter. The weather hopefully is going to cool off a little bit more. I know it kind of teased us a little bit because it got a little cool and then it got warm again. So, but we're really going to be having those shorter days, colder days, which are really going to have us, gathering a little more closely together inside. So we just want to make sure that we're doing the things that have kept us safe up to this point. washing our hands, wearing our masks, really just making sure that we're doing those things and not letting our guard down, because this is really not the time to let our guard down. Because I mentioned before in our last town hall is that Halloween, it was that beginning of that surge we had in the fall and winter last year that was really hard on us. And you can see it displayed here on our graph. You just saw how it took off from that week ending 10/31 of Halloween, and then it just kind of exploded until late January. So just want to make sure that we're ahead of it. We really are just taking that time to do what we need to do to keep ourselves and our clients and families safe. So I am going to stop sharing. I'm not sure if I went long enough to allow Sandy to come on to the call. So I'm going to stop and let Sandy take over.
Great, thank you, Brian. Well, if Sandy is not able to make it on, we all know technology can sometimes be tricky, but Linda graciously offered to share some opening remarks. So thank you, Linda.
Hi, everyone. And we'll keep, Sandy will keep trying, and, maybe she'll be able to share a few thoughts later on today, but just in case, some of the things that I know Sandy wanted to share was first just to extend her thanks and appreciation for everybody that is trying to work through, on top of the staffing shortages, the mandates that we have from different states, working on contingency plans and just trying to pitch in and help each other get through this next period of the COVID mandates. I know Sandy had also wanted us to really take a minute and to hear that many of you know that last Friday, at our Fast Connections office site, that we share with Pathways to Housing, another nonprofit provider. There was a shooting, and a security guard there actually was killed. So our hearts go out to the staff at Fast Connections, the staff at Pathways to Housing, and just really, if you can, take a moment to kind of keep them in your thoughts and your prayers, and to reach out if you can. And then one further update this morning for Philadelphia specifically, because that mandate is a little bit different than Connecticut and Delaware's. We had a meeting with unit directors just to really talk through the specifics of the Philadelphia mandate for unit directors and their teams. So I'm sure a lot of the questions that we shared this morning will be coming up. And, we will, again, just as we said this morning, if questions come up that we don't have the answers to yet, we'll take them down, gather them, and try and get the answers back out. So that's really it for now. Thank you all, and we can turn it back over to Danny.
Great, thank you, Linda. Okay, so now we are ready to hear an update from Alicia on the vaccine reporting update. So Alicia, I'll hand it to you.
Thanks, Danny. Good afternoon, everyone. Good morning if you're in the Midwest. Thank you so much for joining us today. As Danny shared, my name is Alicia Smith. Any of you that I don't know or that doesn't know myself, I am the Chief HR Officer for RHD, and want to kind of just bring you up to speed on where we are with our vaccine mandate. Most of us on this call probably already aware, have seen the email. We're on this call as we've been discussing this, but RHD has begun implementing the mandates that were created and imposed by our funders in particular areas. So those areas include the city of Philadelphia, certain programs in the state of Connecticut, as well as the state of Delaware. We have not yet still received any additional notifications from funder states or their health departments, respectively, that this is expanding. So today I just want to give you an update on those, the processes in those three areas. The vaccine portal has been up. People have been entering. You guys are doing pretty good in terms of getting in your vaccination cards and information, or if applicable, getting your exemption requests submitted and or beginning the testing. So that process has begun. We've been partnering internally. Our technology team, our BTS team, has done a fabulous job of creating an easy to access, easily usable portal system, and that's been used. We've hired an external temporary person to be able to process all of the vaccine submissions that have been entered, as well as the exemption requests. We've also begun the process of having daily reports push out to managers across those areas so that they are aware of their staff that have the percentage of staff as well as which staff have submitted their documentation, which staff have not. And so you should be getting those reports. If you are not, then we're going to ask that you connect with your leadership in your service lines, and or that you email covid.vax@rhd.org so that we can understand. No, I'm sorry, don't use that email. Alicia@rhd.org. Email me and let me know if you have not, only if you are a manager who is not getting reports. Again, one more time. If you are a manager, you lead a department, you supervise staff, and you are not getting reports, either connect with your executive leadership, one of our CPOs, or myself, and we will be sure that the list is full and complete. That list was generated. We had requested from divisional service line leaders to get us the email of who should be getting reports. And so if your name was submitted, you should be getting reports. And if for some reason your name was not submitted, then we're going to ask that you let us know as soon as possible. So we are plowing through the vaccination cards that have been submitted, making sure that they are legible. We have had a few where people have not fully scanned in their card so that it's readable. So please, as you're scanning in your card, make sure that you are scanning it in so that the name can be seen. We've had a few errors, things like people who may not know their employee ID number. So we've got a pretty decent sized list of people who have submitted information who says that they're terminated or that they don't work at RHD. So those individuals will get a notification that your information has not been submitted. And so then you need to go in and resubmit your information into the portal again. You won't be able to access the record that you already submitted, but you'll just resubmit it over again so that we can get it registered and take you off that list that you don't want to be on. The next steps are for us to begin to process through for the City of Philadelphia, the exemption requests that have been coming in. There's only a few, definitely not as many as the vaccination cards that have been submitted. And as soon as we get through those, hopefully by the end of the week, we will be getting notification back to anyone who is not, who has submitted their exemption to let them know whether their exemption has been approved or not. We're coming up on the 15th. Everyone across RHD who is vaccinated was asked to submit their vaccination information. Looking at my notes just to make sure I cover everything because my junior moments sometimes get the best of me. It was asked to submit your vaccination cards, even if you are not in an area that currently has a mandate. Even if you are not in an area that currently has a mandate, we are asking that you submit your vaccination information into the portal because we do anticipate that other states and other areas are going to begin rolling out additional requirements, and it would be so much nicer if for once we could be a little bit ahead of the curve. So that's always the goal, is to get us a little bit ahead of the curve. So we're being proactive and not waiting. So you have that, we have asked that you do that. Covered everything on my notes. I saw, I got a couple emails already. We'll make sure that we address you in terms of the reports that you're not getting. I believe I covered everything.
All right. Well, thank you, Alicia. If you think of something later, feel free to chime in and let us know. So now we're going to pass it over to Brian to give us an update on COVID Corner.
Okay, I'm back, everybody. And hello, RHD neighbors, and welcome to a new segment on Town Hall called Brian's COVID Corner. So at each future Town Hall meeting, we're going to cover one topic from our COVID-19 protocols to review. Now, this week, we're going to talk about our COVID reporting process. So RHD uses the COVID-19 reporting fillable form to track cases in the following status categories: possible, suspected, negative, or confirmed cases for program participants, patients, employees, and independent contractors. So as a reminder, and for clarification purposes, suspected is when someone is showing symptoms of COVID but has not yet received a test to confirm. And a possible exposure is when someone has come into close contact with someone who is confirmed or someone who is displaying COVID-like symptoms. So for example, a client has shortness of breath, chills, body aches. This would be considered a suspected case if no test has been completed to determine status. Any staff or independent contractors or clients that have been in close contact with this client would be considered exposed and would need a report form completed for them. So these report forms are sent to safety@rhd.org. And we also look for the follow-ups for the suspected and the exposures reports too, to make sure our data is complete and meaningful. So updates can also be sent to safety@rhd.org as well, with a confirmation of either a negative or a confirmed result for COVID. So that is it from my corner today. Thanks everybody for listening. The next time we meet, we were going to be reviewing basic safety protocols for COVID-19. Thank you. And Danny, I believe this is now coming back to you.
Great. Thank you so much, Brian. Yeah, we're all looking forward to future updates from COVID Corner. So thank you so much for giving us that update.
You're quite welcome.
So we're now going to watch a video on the vaccines that FPCN put together. So Sherry, I believe you can help tee us up for that.
Okay, fingers crossed. I'm getting there. All right, I'm there. Can you see the screen?
Not yet.
Not yet. All right.
Looks like we're getting some suggestions for a theme song. So if anybody has suggestions, you can also send those over to us. Let's see how.
Yeah, I don't know what happened with the music, but it didn't play. So
Mhm.
next time.
Okay. Well, I think this is Monday for the books in terms of technology issues. So we are also having some struggles with Sherry in the video. So we will find an alternate way to go ahead and pull that up for you guys. Hang tight for just 1 second. Let's take a brief 2-minute intermission. We are working on some multi-level thinking right now to address the technology issues. So hang tight and we'll be ready in just a moment. All right, thank you, Sarah.
One of the developers of the vaccine was African-American woman. I think one of the biggest things is that you have more African-Americans involved in the process. To quote Hamilton, some of us are in the room now.
When I first heard about the vaccines, I was a little reluctant. Once I did my research, I realized that there was a collective effort amongst experts and different organizations around the world.
The science behind the creation of the vaccine isn't new. It's just the virus is new. It wasn't a quick whip up, as a lot of my patients say. This is not the Tuskegee experiment. This is not some conspiracy to harm people of color. For once, people of color have an opportunity to have equal treatment. And it's important that we take advantage of it.
I think like a lot of people, we were all suspicious that they would have a vaccine this quickly. And so I wanted to know what exactly was going on. The vaccine, though, it is good science. They developed a way so that when you get the vaccine, you're actually not getting any of the virus.
It's an engineered protein, and it sends a message, and the body responds with immunity.
That spike protein is just really waking your body up. So if it is exposed to the real thing, that it is ready. Like, come on, I am ready. I'm ready to fight you. It's just like in a boxing ring, like, okay, TKO. You know, that's what we want. We want a TKO.
I was comfortable with getting the vaccine because I monitored the research. The evidence is strong. I'm a nurse and an academician, and then I'm also a trustee in one of the churches. And people wanted to know, why did you do it first? Why didn't you wait? And what was the effect? And people are still calling me to find out how I am doing with it. And I think because I took it, more of the lives I touch will take it as well.
So I was very comfortable with getting the vaccine. I had gotten flu shots before, so I knew that my reaction to it hopefully would not be much different. And it did turn out to be that way. It was not much different from when I got a flu shot. You know, there was some soreness, some fatigue for like the first 24 hours, but nothing that was unmanageable.
And it's not going to cause your arm to fall off. It's not going to cause you to be sterile.
Flu shot is usually every year, it's about 48%, 49%, somewhere around there. Coronavirus vaccine is about 95% effective. It is very effective.
My background is in science. As soon as I heard there was a vaccine, it's just like, sign me up. It felt just like getting a flu shot. I was confident that this vaccine would be beneficial for the majority of the community. Fortunately, my parents want to get the vaccine.
One of the things that we really care about is taking care of our patients. We want to make sure that our patients have whatever they need, whether it's health insurance, whether it's medications. We want to advocate, we want to get our patients these vaccines, and they are the best. Come and talk to us and ask us about it.
It's worth it to get this vaccine to save lives and build immunity in our community.
Okay, thank you so much, Sarah, for stepping in as backup tech support. We definitely appreciate you. So we are now at our portion of the COVID Town Hall to be able to take and answer your questions. So feel free once again to submit your questions using your voice. You can type it in the chat. You can raise your hand. So feel free to go ahead and ask your questions. We're going to start with Sarah to see if you've received any questions that you'd like to start off with.
Yes, I have gotten a couple of questions. The first question is, if my exemption was denied, am I able to collect unemployment?
Hi, thanks, Sarah. This is Alicia again. If your exemption is denied, your next step is to either get vaccinated, or if you are in Philadelphia, well, you would be furloughed and you could get vaccinated, or you would be furloughed for 30 days. If you decide within that first 30 days that you still are not interested in willing or want to get vaccinated, then you would be terminated, as we've said, unfortunately. And then you would go about your process of applying for unemployment, but I'm not able to RHD is not the deciding factor in whether or not you get unemployment. We do respond to the inquiries that come to us from employment as to the reasons for termination, but the decision to to award unemployment or to deny unemployment rests with the entities that are reviewing all of that information. So I can't say that you would get it or not, because it is a work requirement, and so that could go either way, to be very honest. And it's not something that we make a final decision on. So again, if you have had an exemption request that was denied, you would be furloughed and given an opportunity to begin the vaccination cycle. If you choose not to do so, then after that first 30 days, then yes, you would be terminated and you would decide how you want to proceed from there. Again, please note that this mandate is for all providers like RHD across the city of Philadelphia. It's where we're talking about in terms of exemptions, as well as Delaware and Connecticut. But for exemptions, this applies to all of us. And so all providers are wrestling with the same things that we're wrestling with. We have meetings, we're talking, representatives from RHD are joining with representatives from other organizations that also have the same challenge that they're trying to wrestle with and are working with the city, but this is kind of where we all are at this point. I hope that answered the question, Sarah. Okay.
It did. Thanks, Alicia. My other question that came in was pretty specific, so I'm actually going to try to make it a little more general because I do think that a lot of people have questions about this. So the person is specifically asking about how working with a higher risk population may influence whether or not an exemption is accepted or denied. So I don't know who is the best person to answer that, or at least like give more information on that if we have it at the moment.
So I'm going to look to Brandon or to Linda, because we do have some populations, our medically fragile population as an example, and I know that they're working on some of this. So I don't see Linda, but I do see Brandon.
I am here.
Oh, there you are.
Yeah. Hello.
Sometimes you have to talk so the box will pop up. So I don't know if Brandon or Linda, if one of you guys want to take that.
Well, maybe we could take it together. And I can start out by saying we did meet with several of the programs that have a designation by their contract as medically fragile and talk to them about that. And where we are right now is that we're keeping the same standard for those programs as the other programs in Philadelphia. The reason that we are working toward a different answer is that even though those programs may have the designation, we do have other individuals and other programs that also have more complex medical needs. So we want to really approach it in a sort of coordinated way around that. So Brandon,
yeah, I was going to say that I appreciate that. I think you covered it. The only thing I might add is that, as folks would probably expect, we do have a lot of folks that fall under the at-risk categories for the CDC. So as Linda said, we're working with each individual program to identify, hopefully probably a tiered system, which will help us isolate who are most at risk, who are moderately at risk, and those who are really, even though they may have a symptom or a diagnosis that puts them on the list, they genuinely are not a heavy risk or a high risk for COVID infection. So we're working with you guys. If you haven't seen emails already, you'll see some of those coming. I know many folks have already submitted data, and we appreciate your help in getting that list together.
Great, thank you, Brandon. So we have not seen any questions come into the chat yet. Sarah, are there any other questions that have come to you?
I have one more at the moment. The question is, our staff, sorry, they're like coming in as I'm, our staff who are fully vaccinated by 10/15, that's the Philadelphia deadline, supposed to follow the same guidelines as someone whose exemption request was approved?
I think I understand what this is. I think, this is a vaccine mandate question, Sarah. I assume that was for me, but I see somebody else was talking, so I don't want to.
with Sandy.
Oh, okay.
Yeah, hi, everybody. I'm sorry. I had technical problems in the beginning of the meeting, but Sarah, could you say that question again, please?
Sure. So, I'm pulling back up. Our staff who will be fully vaccinated by October 15th, supposed to follow the same guidelines as someone whose exemption request was approved, meaning someone who's not vaccinated because they were able to have an approved exemption.
Right. So the folks who would have the approved exemptions would still have to take the COVID test twice a week. If you are fully vaccinated, that you do not have to do that. That applies only to the folks who have the exemptions.
There is one other qualifier, Sandy, that remember we talked about is if a staff, and again, we're talking about the city of Philadelphia, if fully vaccinated means that I've had either the one J&J shot or both Pfizer or both Moderna shots, plus the 2-week post-shot time. So what the Philadelphia Department of Health has told us is that if in Philadelphia you've had either the one J&J shot or the both shots, either Moderna or Pfizer, but you've not completed that 2-week post period, you can continue to work, but you would need to follow the same guidelines as someone who has an exemption in that you would need to be tested twice a week, mask up, and follow the protocols until you hit that 2-week post period. Does that make sense to folks?
Hello, everyone. I have a question. Hello.
Yes, go ahead, Malcolm.
How you doing? I have someone who's taking their first shot, but the time in between their second shot falls after the October 15th. And I was thinking, what would be the process for them to get back on the schedule?
So again, Malcolm, tell me again, the first shot's in that first 30 days, is what you're saying?
The first shot was taken like 2 weeks ago, but they were scheduled to take the second shot like the 23rd or something. So should they go through just like the protocol as if they had an exemption and take the test 2 weeks, mask up? I mean, 2 times a week.
Well, again, by the 15th, they either have to be done their shots and then can work for 2 weeks masking, or on the 15th, if they are only midway, they need to enter that furlough period. And then as soon as they get that second shot, they can begin work and have that 2 week where they're still masking and testing.
Okay. Thank you.
And if there's a particular, because there's so many different variations that come up, if there's a particular employee or situation, please reach out to your regional director, service line, and we can talk through any specifics for people too.
Okay. Because the person asked me, could they enter into the medical exemption for that time? And then the medical reason being they haven't completed their shot, and then follow the protocols as if they have an exemption, and then be able to fully be back on.
So right now, the medical exemption is only if a physician is saying you should not get the shot. That's what would exempt you from receiving the vaccine, not that you're kind of midway through your series.
Got it.
All right, thank you.
And keep in mind that the J&J shot is just one shot.
Okay, it looks like a few things have come into the chat now. Sherry, would you mind reading a question in the chat?
Yeah, I think this one is quite similar to what Malcolm was just asking. If a staff member isn't scheduled to have their second vaccination shot until 4 days after the deadline, will that staff member be furloughed until they are fully vaccinated? And I think it's fully vaccinated and then fully vaccinated past the 2 weeks. But I think that's what you just clarified, correct, Linda?
Yes, that's the same question. And again, it can get tricky depending on the days, so please reach out. But if on the 15th you're not fully vaccinated, you enter a furlough period until you complete your series.
Yeah, I just want to add some clarity to that. So you're not, after the 15th, the city of Philadelphia's mandate is saying you have to enter the 2-week. If you're fully vaccinated by October 15th, the 2-week waiting period that says you're fully vaccinated. So if I have my last vaccine October 15th, that fully vaccinated period ends 2 weeks later. For anybody vaccinated on October 15th, 14th, 13th, you're still in that waiting period prior to the 15th. You can double mask and get tested twice a week. Anybody whose fully vaccinated date happens after October 15th, you're fully vaccinated on October 16th, any date after October 16th, that 2-week waiting period has to be done as part of your furlough. That 2-week waiting period, as of today, the city of Philadelphia's mandate is stating we cannot have that 2-week waiting period waived in the same way as anybody vaccinated before October 15th. I'm hoping that clarifies for everybody. Alicia, I look to you to make sure that was clearly stated from an HR perspective.
Yeah, so I wasn't clear if everybody started jumping in because there's something more that came in writing that I'm not aware of. I do understand, or I was under the understanding that the city had stated that they were going to give that they were considering, and we had not yet gotten it in writing, and maybe we did get it in writing, that if both of your shots were completed by the 15th, that you would be able to, I know it's, I got you, I'm trying. People are saying that all of that just confused everybody. If you have completed both of your shots by the 15th of October, but you have not completed your 2-week post-vaccination shot period, you are not technically considered fully vaccinated. Everybody's clear about that part. We have been told that the city said, I got you, the city has said that they are considering allowing employees who have completed their shots by the 15th to remain working during those 2 weeks. If we have gotten that in writing, which I will look to someone who's connected, and Bernie is shaking his head, that we've received that in writing.
I'm sorry, Alicia, we have something in writing from the Philadelphia Department of Public Health that states if you've gotten both shots prior to the 15th, but not completed your 2-week post period, that you can work for those 2 weeks with double masking and testing twice a week.
Correct.
And that is beyond the 15th. That is
Correct.
beyond the 15th.
Correct. And again, you've said it in many of these meetings, know that this is a very fluid situation. There's another town hall meeting with folks from the city this afternoon. We'll report back if there's any new developments, but I know it sounds confusing, but the bar keeps moving. We're trying to be clear, and I know we're not always.
Yeah, I want us to try to focus on where like everybody kind of jumping in, I think is what people is getting confused about. So let me just finish if I can. If your first or second shot is after the 15th, you are going to need to be furloughed. You have not completed your vaccination shots. You will need to be furloughed. Is that clear? I'm getting the private chats that are saying, okay, the first part was clear. Second part I just dropped, clear. And then once your vaccinations have been completed, you are fully vaccinated. If you are furloughed, no problem, you're welcome. If you are furloughed, once you have completed your full vaccination shot, your vaccination cycle, then you can be returned to work. If your first or second shot is after October 15th in the city of Philadelphia, you will need to be furloughed, and then you can return after you finish your vaccination. You're fully vaccinated. So I'm hoping that cleared up some of the confusion that just.
Did you mention, Alicia, anything about the extra 30 days?
Yeah, I did that initially, Sandy. When I said that everyone, if you're not, you would have the first 30 days if you would choose, and that within that 30 days not to complete your vaccinations again. Sorry, everybody, if you chose not to do that, you would end up being terminated, unfortunately. If you are in your vaccination cycle, meaning you've gotten your first and second shot, and you're just, you're waiting on your second shot, you got your first shot within that first 30 days, you're waiting on your second shot because of the timing, you can get an additional, you can have an additional 30 days to complete that vaccination cycle. Yes, fully vaccinated is 2 weeks after your last shot. If it's the Janssen J&J, Johnson J&J, whatever the case may be, it's one shot. It's 2 weeks after you've completed your vaccination shots. That's what's considered fully vaccinated.
And just like Bernie said, you kind of said it before me, Bernie, but this is a situation that is changing and quickly. And what we do is we are trying we're trying to keep up with everything that's coming out so that you guys can be informed. So, but this is really a moving target, and it changes from day to day. We just always try to keep up and of course, communicate to you all.
Thank you for that clarification. And if anything is still unclear, feel free to ask another question in the chat. But thank you for taking that time to make this as clear as possible. So there are a few other questions that have come in. Sherry, do you want to read another question from the chat?
Yeah, I'm going to read another one. I also want to just remind folks that last Monday, a frequently asked question document came out. So sometimes for me, when I read it, it's a little bit clearer. So I just wanted to reference that. That came out last Monday. This question is, I'm just confused about vaccinated not having to be tested since a fully vaccinated person recently exposed it to everyone. If they were tested earlier, then it would have been caught early. But I think, why are vaccinated folks not getting tested, I think is the quick version of that question.
So, okay, all right. I'm just want to make sure that the path is clear to jump in. So I believe has come up before. Why are we RHD not asking for vaccinated staff to mask or whatever the case may be? We do have full protocols in place if people are masking. The mandates that we are implementing, this is what we're talking about. These are externally driven mandates. RHD has not, and still currently has not in the past or currently initiated a vaccination mandate for the full corporation. So we're not requiring whatever requirements you are hearing about are requirements that are externally that are being driven externally for all providers, not just RHD, but for all providers. And so therefore we are following to be able to comply with these mandates. Now, again, these mandates are about trying to keep people safe and so on and so forth. So I'm not saying we disagree with them, but that we've chosen to follow our funders and or government in the areas where we serve, where we provide services and support individuals. And so that's why we are doing, implementing these protocols in the areas that they are coming to, that we're implementing them, because those are the areas where they're coming to us from external entities that we are accountable to as an organization. So I definitely understand the concerns about breakout cases and all of these things. I think that everyone, and let me just, I'm going to take some liberty, and hopefully June and Brian will forgive me for stepping out of my lane a little bit. I'm going to say that I believe that everyone should mask, whether you're vaccinated or not. I think we all have the ability to accept a certain level of personal responsibility for our own health and well-being. And, even if you're vaccinated, I still mask. So I think you have that choice to do so outside in the world around you, to give yourself an extra level of safety and precaution and not feel as if your health and welfare is completely in the hands of someone else. So there's a need for us to try to regain a little bit of our sense of self-empowerment when it comes to our own health and well-being. And I encourage everyone to do the same. But the protocols we're being implemented are being those that are being given to us by our external funders and governments where we're providing services that we're accountable to. So I hope that that helps everyone to understand why these areas, why these particular protocols, so on and so forth.
Yeah, thanks, Alicia. Just to highlight again, I put it in the chat. Whether you're vaccinated or unvaccinated, you're still, when you come into your workplace, you're wearing a mask. So that has nothing to do with the testing or all that. You're wearing a mask at work. So just wanted to clarify. And the reason? Well, because there is a mixed status at work and you don't know. So again, thank you so much for wearing your mask, everyone. And I appreciate it. I know my colleagues do. I know everyone should, and our program participants too, because that does help stop the spread and transmission of the coronavirus.
All right, thank you, June. So just as a general reminder, if folks have specific questions about timelines or timeframes about their vaccines, when they got their first or their second, you can also reach out to your leadership and your manager to address those questions as well. So we encourage you to do that as well as asking them during the town hall here. So we have a few more questions in the chat. Sherry, do you want to do another question?
Yes. Is there a plan to roll over additional PTO hours for our staff that have been working overtime and have not been able to utilize their PTO as they normally would?
All right, I am going to take that one. We will have to take a look at what we're going to be able to do as an organization. At the end, I think everyone by now knows that most of our programs and or our staff across the corporation have a part of their PTO plan that allows a set amount of rollover. We encouraged them last year to increase that. I believe, right off the top of my head, I don't want to say 100% confirm what they are because they're different. Each area submits a different PTO plan, but I do believe that those numbers were increased to allow a little more carryover, but I'm not mistaken. If you have questions around what your carryover amount of carryover is, I'm going to have to direct you to one. You could direct you to two spaces, not just one. You can always look in Lawson in your PTO plan to pull up for your particular program or area to see what your carryover was changed to. I'm encouraging everyone to do that because there were changes last year. And I think that sometimes we get into the habit of we've been here for years. It's the same as always has been, that your first stop is to something that you could easily do, go into Lawson, into employee self-service and look at your PTO plan. It'll have all the details and you'll be able to see what was changed, what stayed the same. And then if you have any questions, then please make sure that you see your program manager. There is a certain amount of allowed carryover that already exists. And if we were going to do anything additional, we need to have a conversation about that and what the implications are. So I wouldn't be able to say if that's happening here, because again, I don't know which programs, they're all very different. Some have a higher level of carryover, some have a smaller level of carryover. We do have a corporate limitation. So we'd have to take a look at that. And we will definitely make sure the PTO plan development is about to roll out. So we will be looking at that within the next few weeks and providing updates should anything change for everyone.
Thank you, Alicia. So let's turn it over to Sarah to see if some questions have come in to her. Sarah, do you want to ask some of your questions?
Sure. I've received several questions about the timeline for approval or denial of exemption requests. So I'm just wondering if there's any more information that we can share with folks about those timelines.
Is that the question again about the timeline for an exemption to be approved?
Well, folks are asking specifically, like, if I turned it in the the day the link was active? How long should I expect to wait to hear either way?
Right. So that's what that's what I was asking. Thanks, Sarah. So as I said earlier, we have gotten through a significant portion of the vaccine cards and hope to get through the exemptions by the end of this week. The ones that have been submitted to date, our hope is to get through them by the end of this week and to get notification back to individuals so that everyone's aware of where they stand. That is what we're pressing toward. We have about 1,500 vaccinations to get through and about maybe 50 or so exemptions, 50 to 60 exemptions the last time I checked it. So we hopefully will get through them and by the end of this week be able to get some response back so that everyone knows what they need to do next. Sarah, does that answer?
Yep. Thanks, Alicia. I'm sorry if you had already answered that and I missed it.
No, don't worry about it. There's a lot going on.
There's a lot going on.
Keep track of. It's all over the place.
Okay, so I have a question here. Even though CDC guidelines do not require temperature testing to enter a building, to make employees feel more secure with program participants coming in and out of a building, why not bring back temperature testing? Seems like a question maybe for June, I'm guessing.
So we are going with the CDC guidance. I know that the temperature testing was cumbersome and it didn't really, it's not a total indication when someone's sick. We trust that people would stay home if they were ill and not bring anything into the workplace. So again, that's why we did away with that. We believe that the masking, the washing hands, keeping our social distance, all those other COVID protocols are sufficient in assisting with the reduction of transmission. So that's why.
Okay, thank you. And Sarah, are there other questions that have come in that you'd like to ask at this point?
Yep, I can just keep going. Let's see. If a person is terminated due to not meeting the vaccination requirement, will they be paid vacation time? Like, will their vacation time be able to be paid out? Guessing that's an Alicia.
Thanks, Sarah.
Yep.
Yes, so RHD's policy is that any employee upon termination is paid out their vacation time, not sick, but their vacation time. So yes, if there's unused vacation that remains, that would be paid out to the employee.
Thanks.
Okay.
Danny, I have two more. Are you good with me continuing?
Yeah, that sounds good.
Okay. Will FPCN be offering weekly testing for employees who have an approved exemption?
So in conversations with Emily at FPCN, they, like everyone else, have staffing limitations. They have regularly scheduled times during the days if you're able to get those appointments. We are in the process of seeing if we can add some capacity utilizing outside staff that would be supervised by FPCN. We don't have that totally figured out yet. We hope to have that figured out by the end of the week. And once we do, we'll get back to folks, but we are exploring the possibility of adding some capacity.
And I would tell you, if anyone is needing testing, to go ahead and start making an appointment with FPCN right now.
The other thing that we sent out to unit directors in the Philadelphia area at the end of the day on Friday was an email that listed 95 locations that the Department of Health in Philadelphia has contracted with to provide testing for healthcare workers, and know that our staff are considered healthcare workers. So talk with your immediate supervisor, and if they don't have the list, you can reach out to me or Sandy. It's Bernard at rhd.org or Sandy at rhd.org. Or Sandra.
Sandra at rhd.org.
Sandra at rhd.org. And we can forward that list to you. It's 95 sites sprinkled throughout the city. It's some Department of Health sites. It's a lot of Rite Aids, it's CVS's, and various other organization. So there's 95 sites throughout the city, which again, that sounds initially like a whole lot of sites, but we don't know the volume at RHD yet, and just multiply that by all the different vendors. So Sandy's point in that, if you've submitted for an exemption, as soon as you hear, you should go ahead and start scheduling your testing, please.
Right. And also, if you've decided that you are going to go ahead and get the vaccine, to go ahead and go as soon as possible. And also for some of the leadership teams, we're asking that you start thinking about, if you're going to be suffering any kind of staffing loss. And if that's the case, to go ahead and get in touch with me or Bernie, because everyone is going to be in competition for temp agency help. So the sooner I know something, I can at least, make sure that we're first in line.
All right. Thank you, Sandy. Thank you, Bernie. Let's go ahead and check in on some questions in the chat. I think a few have come in over the last few minutes. Sherry, is there a question that you can pull from the chat?
Yes, and I'm going to mix it up and do one on the IT side. Some people are reporting that they have uploaded their vaccination proof, but are showing up as a no on the detailed reports the managers receive. Is service desk the best contact for those issues?
Sherry, I guess I got that one when you said it's an IT issue. So if you have an employee who's still showing up on the reports after they have uploaded their vaccine card, that means that they did not enter their employee ID correctly. So they have two paths they can take from that, or you have two paths you can take as the manager. The first is encourage your employee to re-upload their card with their correct employee ID number. The second is if they have their record number that they are given after they submitted their vaccine card, you can reach out to me at tara.drennan@rhd.org and let me know that record number. From there, I can give you the information associated with that record number of what employee ID was added, and we can try to go through the process of getting that corrected in the system. So again, you have two paths. The employee can either re-upload their vaccination card with the correct employee ID, or you can reach out to tara.drennan@rhd.org with the record number and some information about who the employee is, and we can go in the system and make that update.
Okay, thank you, Tara.
Hey, Tara, don't go away.
Never mind, Tara.
Do another IT one. My unit's PTO plan does not come up when you click on it on Lawson. Would you know why?
So that is actually not an IT question. That is a question for Alicia, who will be happy to answer that.
Sarah, I love you. You're so funny. Yes. So their PTO plan does not come up. It should. I don't know, but email Lawson help at RHD. So you should be able to click on Lawson help when you're in Lawson, or you can email Lawson help.
Okay, great. And I see Tara just put that in the chat as well. So lawsonhelp@rhd.org. Is there another question in the chat, Sherry?
Yes, I'm not sure who this one goes to, but I do want to read it out loud because I think we had one like this last week as well. If I agree to receive an EUA COVID injection, I don't know, does my Employee Health Wins plan provide complete coverage should I experience an adverse event or even death? I don't know what EUA is.
I think that's emergency use authorization.
Yeah, and so anytime there's something that's incorrect about a vaccine being administered, that would be something between you and the medical provider.
Thank you.
Okay, thanks. Is there another question in the chat, Sherry?
There is. Hold on now, I gotta go down a little bit. Okay, is the furlough time for all employees or just the ones that decided to get the vaccination? Just the one.
So I have, because the question is not, I might have to make some assumptions. So I'm assuming that this person is saying, I'm not getting the vaccination by the deadline, and it's the furlough for me. So anyone not vaccinated by their deadline, their initial step is that they will be immediately furloughed. The deadlines are different in different areas, but you would be furloughed for 30 days. If within that 30 days, you have not begun the vaccination cycle, then that would not be extended. If within that 30 days you have begun, those 2 steps, their deadline comes, I'm not vaccinated, furlough. I'm on the furlough, I begin the vaccination cycle, it can be extended. I'm on the furlough, I do not begin the vaccination cycle, it will not be extended. So I'm hoping that was clear, Sherry?
I think so. Yes.
Okay.
Okay, well, why don't we check in and see if there are any other questions that have come to Sarah at this point, and then we can hop back to the chat if some more come in.
Here. So it says there are staff that will get their second shot after 10:15, but they're not willing to get tested twice a week. Are staff allowed to use their PTO time? I'm guessing they mean during that gap.
Let me just say this about the first part of that. I'm looking at it. There's no opt-out. Staff always have the ability to use PTO. And so whatever PTO you have available to you, you need to follow your protocols, submit that information to your supervisor so that your supervisor and you can, understand what's necessary in terms of coverage, so on and so forth. So you would follow those normal steps. So yes, staff are able to use their PTO. You will not accrue additional PTO. If you're on PTO, if you're on furlough, you're not, and you can use your PTO while you're on that furlough, you are not able to accrue additional PTO. That has been one thing that has changed, but that's something, again, you would have to have a conversation with your supervisor. All supervisors are responsible for making sure that there's appropriate coverage, that the needs of the consumer and or department are being met. And so they really need you to work with them and not just kind of like walk off, so to speak. Hopefully, I don't think anybody would do that, but I definitely would encourage you to work with your supervisor to negotiate that. And we trust and empower our directors and leaders and supervisors to be able to manage that with their staff, for sure. They can absolutely manage that with you guys.
Felicia. Danny, I have a few more. Are you good with me continuing?
Yeah, absolutely.
Okay. And just so folks know, when you send me a private chat in Zoom, I do see it. And what I'm doing is I'm copying and pasting it in with the other questions that I'm getting from your voice. So if you don't hear the answer to your question, it's just because I'm trying to answer them in the order that I'm getting them. But I am seeing them, so thank you. Okay, so if my exemption is approved, do I need to double mask out in the community, or is it just in the office? And this is coming from someone who's a mobile worker.
So if you, somebody else? Okay, I'll keep going. And then I'll turn it over. Brandon, Linda, Sandy, Bernie can answer this as well from a service side of it. But if you are out in the community and you're going in and out of consumers' homes or spaces where you're working with consumers, then yes, if you are expected to follow those protocols. But I'm going to turn that over to the program ops. I saw Brandon just come off.
Yeah, appreciate it, Alicia. I think the safest way for us to consider it is if you're working with clients or you're during work hours, consider that a mandate during all work hours. So if you are with clients, you're interacting with folks, whether you're in an office setting whether you're in the individual's home or whether you're transporting that individual, whatever that case may be, consider it work hours, consider it direct support, direct contact, and use your precautions of wearing the masks.
Great, thank you. Sarah, do you want to ask another question?
Yes. Okay. If directors do not have any information about exemption approval statuses by 10/15, so October 15th, should we put staff on furlough?
Yes, so if your staff have submitted a request, which if they're going to need an exemption, I'm encouraging them to do that. You will know the status of their exemption by the end of this week. If anyone submits that request at a later point and we're not able to get to it, then yes, they are furloughed. So it's incumbent upon the staff to make sure that if you know today whether you need an exemption or not, put your request in. Don't wait until the last minute. Please do not wait until the last minute to put your requests in. I am imploring and encouraging you not to wait until the last minute. It is very important that if you know today you're going to need that exemption to request to be submitted, that you do so as soon as possible. That's a way for you to be able to have a little more control in terms of being able to get a response. The sooner you submit it, the sooner you can get a response. If you wait until the last minute, I cannot guarantee that it will be done by October 15th.
Alicia, don't go too far. Is it possible for a manager to allow an employee to work from home permanently if they get the exemption? This way, the employee won't have to be tested twice a week.
So, I think that there's two parts to this question. One is the question around, is anyone at RHD 100% remote? And I think that that's a conversation that we're continuing to have because it's been pretty clear. And then somewhere in there, I think got confusing for people. We recognize that right now, all of us are not following what will be when we return to some level of normalcy, our normal work situations. I think that the challenge we have is that there are some individuals who are working remotely who still do access and need to access RHD work sites. You have a desk, it means you're coming into the office at some point. If you need to bring your laptop in to get it looked at, if you need to go in and pick up paperwork, if you need to, any of those things, it means that you are not 100% a remote employee. Managers will have to negotiate with, based upon their responsibilities to manage the workflow and the needs of their department, what they work through in terms of employee schedules in a fair and consistent way. So it's up to managers to really understand that's their charge. And when you're a manager, your charge is to manage the workflow for your area of responsibility. So you understand clearly what you need your staff available for and to do, and all of those things. And that's part of what you're trying to work through when you're making those agreements. But I want to make sure that everybody understands that there are some jobs that can be done, large amount of work can be done remotely. That's not the same as being 100% remote. Just because a lot of your work can be done remotely doesn't mean that you're a 100% remote employee. And there are some jobs at RHD that cannot be done remotely. So it's not possible to have one RHD-wide policy around everybody's able to work remote. So it is really up to the managers to understand the workload that they're responsible for managing with their staff and to make those agreements in a fair and consistent way. And I cannot stress enough, fair and consistent way, because I think that's sometimes where we get a little bit of it gets a little sticky and tricky. We want to make sure that everyone at RHD feels that they have access to fair treatment in their work and consistent treatment in their work. So I am going to kick that to the managers. Now, I don't know if there's any other from Program Silence to Sandy or Brandon, in terms of some of the programmatic positions, that they don't have the ability, but there are some positions that may have that ability, and you may feel differently.
Yeah, all I would reiterate is the fact that we would need to go through your supervisor. So you would need to take that to your supervisor and have those discussions for anybody who would, who you believe would qualify, or if you believe you do, again, go to your supervisor, but your supervisor should be aware of who would qualify, and we'd be able to have those conversations to make sure we have that identified. So thank you, Alicia, for covering it.
All right, great. It looks like a few more questions have come into the chat. Sherry, would you mind reading one of those?
Yeah, so we have a lot that have come in, but I'm also going to take another old one because I think it's one that came in last week as well, and I don't recall if it got answered. Does the double masking and twice weekly testing also apply to staff from outside staffing agencies?
So what we are.
Yes.
We are working with our outside staffing agencies and asking that they only send us vaccinated staff.
Great.
They are
Thank
still
you.
required to wear masks in our programs.
Thanks. Sherry, do you want to read another question in the chat?
Yes. Sorry, I have to go down. I didn't want to lose that one. I think I'm going to go to the bottom and work my way up now. Looks like some of these are people making comments. I have to get tested if I am working for those 2 weeks post-shot from home.
If you are not coming into an RHD work site, you do not. If you're not going into consumers' homes, you do not.
How are furloughed staff able to enter their PTO time if they will be on inactive status and cannot access Lawson?
There is a different status that we will be using. It's not the current status, and that information, as soon as that status line is clear for me, will be coming out this week. The code, the statuses that you're using will be coming out this week.
All right. Thank you for that answer. Let's check in with Sarah and see if any questions have come into her recently.
Yes, I have a bunch here. This is for Tara Drennan. When will there be a Chiclet and Lawson for uploading the first test to prove staff have had it in order to be eligible for the next 30-day exemption?
Sarah, I'm a little confused by the question, but I will repeat it differently and answer that. And if you need clarification, let me know.
Yeah, yes, agreed.
Okay.
Good plan.
So the testing Chiclet is available in Okta. It is actually there today. For areas of the organization where testing is mandated now, Bernie, I believe you sent the instructions out to Connecticut and Delaware already on how to use that. So larger communication will go out to Philadelphia as it gets closer to the day where they should be uploading testing. That Chiclet is currently available in Okta today. It looks just like the Chiclet for testing and the exemption process in Philadelphia, but it's available today. Sarah, I'm not sure about the 30-day part of it. The testing requirements right now for Delaware and Connecticut are weekly testing, and the testing requirement for Philadelphia will be twice weekly testing.
Tara, I think, and maybe I'm mishearing Sarah, I think what folks are asking is, if I'm on furlough and I got my first shot, what documentation how do I submit documentation to RHD that will qualify me for that second 30-day furlough so I can get my second shot? Sarah, is that what you think the question is asking?
Yeah, that's how I was interpreting it, Bernie.
or even the first 30 days, I think also, right? Both. So
Right.
how are we confirming, and is there a system? I will say this question came up in our joint IDD BHH meeting this morning. And maybe the reason for the chiclet question was we didn't know, we were presuming it might look similar to one of the chiclet systems we have, but we would end up having some tracking mechanism to know who would be eligible for furlough. So the question would be either that first 30 day or second 30 day, how are we tracking, knowing where they are in the process? That was probably the question.
Yeah, so Brandon, I don't think that's a technology question at this point. I think that's an operations question at this point. I would ask Sarah to document that question and we'll put it on our next FAQ.
Sounds good. Thanks.
Okay. How will the employee be notified of their exemption status? Will it be available via Chiclet and Okta, an email, or their supervisor?
An email. The employee and their supervisor will get an email.
I'm just going to keep asking questions because I have a few more here. Will booster shots be part of the mandatory mandate?
What I can say is that right now, there is nothing in the mandate that we are familiar with right now. But as Bernie said, there's a meeting tomorrow with the city, there are upcoming ones, and that could change. Bernie, would you anything different to say?
No, I think that hits it. You know, we don't have any mandates that require boosters now, but as soon as we hear that we do, we'll share it with the group. But as of yet, nothing.
Thank
Okay.
you both. Danny, I have one more if it's okay.
Yeah, well, let's do one more and then we'll go ahead and check in on the chat again.
Yep, this is just someone asking for, further clarification, I guess, on our protocols. Are residents required to wear masks in their homes with those with exceptions? So I'm guessing they mean if a staff person has gotten a vaccine exemption, will the residents who are, I guess, around that person need to be wearing masks in their homes? Sounds like a June question. There you go.
Repeat the question.
Sure. Person asked, are residents required to wear masks in their homes with those staff members who have gotten exemptions?
Right. Well, first of all, everybody's supposed to be masking up unless they're in their own room in the program. And that means staff and clients. So that's a COVID protocol, unless they are more than 6 feet away or outside, doing something outside that is also socially distanced.
All right, thank you, June. So just for a quick time check, we have about 10 more minutes. So we'll do a few more questions and then we'll end with some closing remarks. But let's check in with Sherry and look at some questions in the chat.
Yeah, I'm going to take these ones at the bottom around testing. We have one. I have a question regarding how to get testing twice a week. I attempted to set up a second testing for the week at one of the free testing pharmacies. It asked me if I'd been tested within the last 10 days, and it wouldn't allow me to schedule testing. Where can I get the second test free of cost or low cost?
So that is new information to us. We will, I will pose that question at the DBH Town Hall meeting today. Our understanding is that if you go to one of those sites that either is the Department of Health or has a contract with the Department of Health, that site of 95 partners that we talked about earlier, that as long as you identify yourself as a healthcare worker, you should be able to test twice a week, even if you are symptom-free. I guess what I'm hearing is that is not the case. So we will pass that question on today. And as soon as we get an answer, share it back with the group.
Great, thanks, Bernie. Is there another question in the chat, Sherry?
Yep. Can you repeat what was regarding if your exemption request was denied?
Say that again, Sherry. Repeat which part?
Yeah, I don't know. This came at 1:41, so I have to say I can't say exactly, but maybe you can address what happens when an exemption request is denied.
So if your exemption request is denied, you will get that notification and you will need to, the only alternative for you is to get vaccinated at that time. If you're in the city of Philadelphia and you submitted an exemption, your exemption is denied, your alternative is to begin the vaccination cycle. When you're on that vaccination cycle, until you're vaccinated, you will need to furlough while you begin that vaccination cycle. If it's at this point, you're going to need to furlough because you wouldn't even have had the second shot unless you get your single shot Johnson J&J. If you get that one before the date, then you would be within that 2 weeks. All you have is the remaining 2 weeks to become fully vaccinated, and you would have to follow the protocols as June, or I can't remember at this point who already laid those out. If you have not begun the vaccination cycle by the 15th of October, if you're in the city of Philadelphia, because you submitted an exemption and your exemption was denied, then you will need to be furloughed immediately. And then you make a choice within that first 30 days to either begin the vaccination cycle, or you can choose not to get that vaccination cycle. If you choose not to get that vaccination cycle started in that first 30 days, then you would end up being terminated because you would no longer be eligible for employment with RHG or with any of the providers that this is subject to. If you begin within that first 30 days, that vaccination cycle, and your second shot falls outside of that 30 days, then you would be eligible for the second 30-day extension to complete the vaccination cycle and then return to work. So hopefully that was clear. If not, let me know and I'll try again.
I was going to stay on the topic, Danny, real quick. There's one more about exemption. Will exemption approvals be sent to unit directors as well?
Again, the exemption results will be sent via email to the employee, and each unit director gets a report. Again, if you're not getting your reports, we will, you're emailing so that we can check into why you're not getting reports for your unit, but the report details who has submitted their vaccination, yes or no, what the results are of that validation. It'll also detail who has submitted an exemption request and whether or not that's already been processed, yes or no, approved or denied. And will also indicate people that have begun to upload their testing information. So your report as a manager will show you all of that.
All right. Thank you for
Sure.
that answer. We have time for maybe one more question. Sherry, do you want to read one more question from the chat?
Yeah, this is a quick, this is back to the testing. Thank you from Robin. Can I get the list of the 95 testing centers? So I don't know if that's something we're going to provide or house on the COVID website.
Do you have those? I'm sorry, Bernie, go ahead.
Oh, I was going to say, yeah, we have those. We share at unit directors. I can talk with Tara about seeing if we could post that on Lawson. That's a good idea. And Robin, I can forward that email to you when we're done here. But we'll figure out how we disseminate it more broadly with folks.
Perfect. Thank you, Bernie. So we're cutting close on time. So I wanted to just remind folks that we'll save the chat so we can have a record of all the questions that you're asking. Thank you so much for all your questions coming in. And feel free to continue to ask questions through the coming weeks. I'm going to hand it over now to Deanna for some closing remarks.
Good afternoon, everybody. I am Deanna Serwin, your CFO. I got nominated to make closing remarks today. And to start them, I just wanted to acknowledge how stressful COVID is on everybody, how much the mandate has increased our stress levels. And it feels different for everybody. I want to express my sincere gratitude for everybody, the hard work they do in serving the RHD community, our consumers, our clients, their families, our fellow staff members. There are a lot of questions being asked, and I'm sure there are a lot of individuals with unasked questions. So I encourage you to ask those questions, have the conversations that need to be had, get the answers so we can try to move forward. To recap today, safety first. Let's all wear our masks and wash our hands. All of June's her W's. Brian's COVID Corner, fabulous. Love the addition. Can't wait to see it next time we get together. And vaccination reporting. Please make sure if you have not yet gone to the Chicklet to do your reporting that you get there. I will wrap it up with this quote. It's from Albert Einstein. This is learn from yesterday, live for today, hope for tomorrow. The important thing is not to stop questioning. So make sure, please, 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 you ask those questions. I thank everybody and I hope you have a great day.